As doctors, one of our key responsibilities is to support patients in difficult situations. Effective communication is crucial, especially when guiding patients through sensitive decisions. Today, we will see the case of Mr. Chand, a 28-year-old married man recently diagnosed with HIV. His wife is pregnant, but he refuses to disclose his status as he fears rejection and stigma. As his doctor, my role is to counsel him, encourage voluntary disclosure, and uphold ethical medical practice. Let's see how this can be done using the gather approach. Mr. Chand, I understand that this news has been overwhelming for you. You might be feeling a mix of emotions: fear, worry, and uncertainty about the future. I want you to know that I'm here to help you through this. You mentioned that you are afraid your wife will leave you if she finds out, and you are worried about being judged. These are valid concerns. Many patients feel the same way after an HIV diagnosis. Tell me, what specifically makes you hesitant to disclose this to her?
I don't want to lose her.
I understand. You love her and fear this may change your relationship. But let's also think about her health and your child's health. Your wife is pregnant, which increases the risk of passing the virus to the baby if not detected early. With proper medical care, we can prevent mother to child transmission almost completely. By informing her, you are protecting both her and your child. She can get tested and, if necessary, start treatment immediately.
I don't know if I can do this.
It's completely understandable to feel this way. Let's talk about how we can make this easier for you. You don't have to do this alone. There are different ways we can approach this. You can choose to tell her yourself, and I can guide you on how to do it. Or I can be present when you talk to her, offering medical support. If you find it too difficult, a trained counselor can help facilitate the conversation. Which of these would you be most comfortable with?
Maybe with support.
That's a great step forward. Let's plan how we can support you in this. Once you are ready, we can arrange a private session for you and your wife. I will explain the medical aspects so that she understands it as a health concern, not a personal failing. You are not alone in this, and we will support both of you throughout this journey. Take some time to process this. I will schedule a follow up in 2 days, and we can discuss how you feel and prepare for disclosure. Remember, this step is not just about disclosure, it is about protecting your wife and baby's health while ensuring you receive the best care. Counseling is about guiding, not forcing. With the gather approach, we ensure that patients feel heard and supported while making responsible decisions for themselves and their loved ones.